You woke up this morning with your mouth completely dry, tongue stuck to the roof of your mouth, lips cracking, that stale taste that no amount of water seems to wash away. You think it's nothing, just dehydration. Maybe you slept with your mouth open. But what if I told you that dry mouth is your body screaming something at you that you've been ignoring for years? Picture this. It's 5:47 in the morning. You open your eyes before the alarm even goes off. And the very first thing you notice, before anything else, is that your mouth feels like sandpaper. Your tongue is thick and heavy. Your throat burns like you swallowed chalk in your sleep. You reach for the glass of water on your nightstand, gulp it down, and within 20 minutes, it's dry again. You brush your teeth, drink coffee, go about your day, and you never think about it again. That right there, that moment you just dismissed without a second thought, might be the most important signal your body gave you today. And you threw it away like it was nothing. I need you to really hear what I'm about to say. Not casually, not while scrolling your phone. I need your full attention. Because this isn't one of those things you can keep pushing to the back of your mind. Not anymore. Not after what I'm going to show you. Let me ask you something, and I want you to answer honestly, even if just to yourself. How long has this been going on? A few weeks? A few months? Or maybe you can't even remember when it started, because it crept in so gradually, so quietly, that it became your new normal. Here's another question. Have you noticed your teeth getting worse lately? More cavities showing up out of nowhere, more sensitivity to cold drinks, gums that bleed a little easier than they used to? And one more. Do you wake up in the middle of the night, not from a nightmare, not from noise, but because your throat is so dry it actually wakes you from sleep? If you just nodded to any of that, don't go anywhere. Stay right here. Because what I'm about to walk you through isn't something most people ever connect. Most physicians don't connect it either. And that's the terrifying part. See, dry mouth, or what we call xerostomia in clinical settings, sounds harmless, almost laughably trivial, like something you deal with by taking a sip of water and moving on with your life. But behind that innocent-sounding dryness, there's often a chain reaction happening inside your body that nobody, and I mean nobody, is talking to you about. And I say nobody deliberately, not to be dramatic, because in over 2 decades of clinical practice, I've watched hundreds of patients walk through my door carrying symptoms that had been building silently for years. Joint pain that wouldn't respond to treatment, chronic fatigue so deep that 8 hours of sleep felt like 2. Recurrent infections, mouth sores, urinary tract infections, sinus issues, cycling back every few months. Brain fog so thick they couldn't recall the name of their own street. And buried underneath every single one of those complaints, a mouth that had been dry every morning for as long as they could remember. Nobody connected the dots. Not their general practitioner who chalked it up to aging. Not the dentist who kept filling cavities and billing insurance. Not even the ENT specialist they paid $400 to see about the sore throat that wouldn't quit. Let me be direct with you. Bluntly, uncomfortably direct. The reason nobody connects these dots is because dry mouth doesn't show up on a standard blood panel. There's no box for it on the intake form at your doctor's office. And because it doesn't scream, because it whispers, because it sits quietly in the background while louder symptoms steal the spotlight, it gets overlooked, dismissed, ignored. Every single time. But here's what nobody tells you about saliva. Saliva is not just moisture. It is not some passive lubricant keeping your mouth comfortable. It is one of the most underappreciated, under-researched, undervalued fluids in human biology. Your saliva contains antimicrobial enzymes, lysozyme, lactoferrin, peroxidase, that actively fight bacterial invasion in real time. It contains immunoglobulin A, your body's frontline mucosal immune defense. It buffers acid, neutralizing the corrosive byproducts of every meal. It initiates carbohydrate digestion before food even reaches your stomach. And it remineralizes your tooth enamel continuously, laying down calcium and phosphate to repair microscopic damage before it becomes a cavity. When your saliva production drops chronically, not because you're thirsty on a hot afternoon, but as a persistent daily pattern, the consequences cascade in ways that would genuinely alarm you if you understood the full picture. Let me paint it for you. First, the microbial ecosystem in your mouth shifts. The protective bacterial species that depend on adequate saliva get outnumbered. Harmful acid-producing bacteria like Streptococcus mutans and Lactobacillus multiply unchecked. That's when the cavities appear, the ones that seem to come out of nowhere even though you brush twice a day and floss religiously. The gum inflammation that flares up and never fully calms down. The persistent bad breath that mouthwash only masks for an hour before it creeps back. But here's where it goes much deeper than your mouth. Your oral cavity is the gateway to your entire systemic health. This isn't some fringe theory. Research published in the Journal of Dental Research, the European Journal of Preventive Cardiology, and multiple studies from Harvard School of Public Health have demonstrated that chronic oral dysbiosis, the exact kind of bacterial imbalance triggered by persistent dry mouth, is directly linked to systemic inflammation. And systemic inflammation? That is the engine behind cardiovascular disease, metabolic syndrome, insulin resistance, autoimmune flares, and accelerated cognitive decline. So that morning dryness you keep shrugging off, it's not just a mouth problem. It was never just a mouth problem. Now, why is your mouth dry in the first place? This is where things get uncomfortable, because the answer is rarely simple. And it's almost never, just drink more water. If only it were that easy. Let me walk through the most common culprits, and I want you to pay close attention. Because at least one of these, probably more than one, is staring you in the face right now. Medications. This is the big one. The silent epidemic hiding in your medicine cabinet. And it's the one that makes me the most frustrated as a clinician, because it's so preventable, and yet it's so rarely addressed. Antidepressants, SSRIs, SNRIs, tricyclics, nearly all of them reduce salivary output. Antihistamines, the ones you take for allergies every spring without a second thought. Blood pressure medications, diuretics, muscle relaxants, anti-anxiety drugs, opioid-based painkillers, even some over-the-counter acid reflux medications. Over 500 commonly prescribed medications list dry mouth as a known side effect. 500. And let me ask you this. How many times has your prescribing physician sat you down, looked you in the eyes, and said, "By the way, this medication is going to reduce your saliva production significantly, and here's what you need to do to protect your teeth, your gut, and your immune system while you're on it"? I'll tell you how many times. Almost never. That conversation almost never happens. I had a patient, Colleen, 58. She managed a botanical garden in upstate New York. Brilliant woman, meticulous about everything. She'd been on a blood pressure medication for 6 years and an SSRI for 4. When she finally came to see me, she had 9 new cavities in a single year. 9. Her dentist was baffled. Colleen had always had exceptional teeth, perfect oral hygiene, fluoride toothpaste, regular cleanings. Nothing had changed in her routine, except that her body was now producing nearly 40% less saliva than it should have been. 2 medications, working in tandem, silently draining her salivary glands dry. And nobody told her. Nobody even thought to check. That's the kind of case that keeps me awake at night. Genuinely. The second culprit is mouth breathing during sleep. And this one is insidious because you might not even know you're doing it. Your partner might not notice. You certainly can't monitor yourself while you're unconscious. Nasal congestion from allergies, a deviated septum you never knew you had, enlarged turbinates, sleep apnea. Any of these can force your body to breathe through your mouth for hours on end at night. And when your mouth is open and air is flowing across your oral tissues for 6, 7, 8 straight hours while you sleep, your salivary flow essentially shuts down. Your teeth spend the night marinating in acid with zero protection. Every single night. Think about that. Third, and this is the one that gets overlooked the most, the one that makes my heart sink when I finally diagnose it: autoimmune conditions. Sjogren's syndrome specifically. This is an autoimmune disorder where your own immune system turns against your moisture-producing glands and systematically destroys them. Your salivary glands, your tear ducts, sometimes your sweat glands, your vaginal moisture glands. Everything that produces lubrication in your body becomes a target. It affects an estimated 4 million Americans. The vast majority, nearly 90%, are women. And the average time from symptom onset to correct diagnosis? 7 years. Let me let that number breathe for a second. 7 years. 7 years of dry mouth, dry eyes, aching joints, and fatigue so crushing you can barely get through the afternoon, before someone finally orders the right antibody panel. 7 years of being told it's stress, it's perimenopause, it's anxiety. Drink more water, use artificial tears, try sleeping earlier. I had another patient, Priya, 46, a civil engineer who designed bridges in the Pacific Northwest. Sharp mind, incredible work ethic. She came to me after 3 different doctors dismissed her dry mouth as stress-related. Her eyes were so dry she'd stopped wearing contacts. Her joints ached every morning. She'd lost 14 pounds in 4 months without trying because eating had become painful. Her mouth was so dry that food felt like sandpaper going down her throat. She told me she'd started avoiding lunch meetings at work because she was embarrassed by how long it took her to chew and swallow a simple sandwich. When I ordered the SSA and SSB antibody panel, her results came back textbook positive for Sjogren's. Textbook. And she sat in my office and cried. Not from sadness, but from relief. Because for 3 years, she'd been told nothing was wrong. And now, finally, someone had named it. That moment stays with me. Here's what I need you to understand about all of this. Even when Sjogren's isn't the cause, even when it's medication-induced, or related to breathing patterns, or connected to hormonal shifts, or tied to poorly managed diabetes, the damage from chronic dry mouth accumulates silently and relentlessly. Your enamel erodes layer by layer. Your gums recede, exposing sensitive root surfaces. Infections take hold in places they never should. Fungal overgrowth like oral thrush, bacterial infections in the parotid glands, angular cheilitis at the corners of your lips. The bacterial load in your mouth begins disrupting your gut microbiome. Your compromised gut weakens your immune response. Your weakened immunity feeds back into more inflammation, more fatigue, more joint pain, more brain fog. It's a domino chain. And the first domino, the one that started the entire cascade, is that dry mouth you've been ignoring every single morning. Now, I want to pause here for a moment. Take a breath with me. Because if you've made it this far, you're clearly not someone who ignores things easily. You're here because something resonated. Something in what I've said matched something you've been feeling. Maybe for months, maybe for years. And a part of you already knew, didn't you? A part of you already knew this wasn't normal. So let me ask you this. If what I'm describing sounds like your mornings, your nights, your life right now, I want to hear from you. Drop a comment below. Tell me where you're watching from, what country, what city. Tell me if this is hitting close to home. Because I'll tell you something I've learned after decades of doing this work. You are not alone. Not even close. And sometimes, just knowing that someone out there understands, that someone actually gets it, is the thing that finally gives you the courage to stop accepting it and start demanding answers. Good, let's keep going. Because there are layers to this we haven't even touched yet, I want to talk about what chronic dry mouth does to your sleep quality. And this is a vicious, self-reinforcing cycle that almost nobody discusses in mainstream medicine. When your mouth is persistently dry at night, your body interprets that dryness as a low-grade threat. Your autonomic nervous system stays in a state of subtle activation, not enough to fully wake you, but enough to prevent you from dropping into the deep, restorative stages of sleep your body desperately needs. Stage 3, REM. The phases where cellular repair happens, where memory consolidates, where your immune system recalibrates. So you spend the night in this shallow, fragmented state. You technically slept 8 hours, but your body didn't repair. You wake up exhausted, foggy, irritable for no identifiable reason. Your cortisol is elevated because your body never got the hormonal reset that deep sleep provides. And elevated cortisol, this is the cruel twist, further suppresses salivary gland function. So the dryness worsens, and the sleep deteriorates, and the fatigue deepens. And round it goes, a cycle with no exit. I've seen patients trapped in this loop for years, spending thousands on sleep studies, trying melatonin, magnesium, ashwagandha, trazodone, weighted blankets, cooling mattresses, blue light glasses, white noise machines, everything they could throw at the problem. And the root issue was sitting right there, on their tongue, literally. Here's something else that rarely gets discussed, something that touches on dignity, on quality of life, on the small daily pleasures that make existence feel worthwhile. When your saliva disappears, eating changes, fundamentally. Swallowing becomes effortful. Dry foods, bread, crackers, rice, granola, feel like they're getting stuck halfway down. Some patients develop this reflexive cough every time they swallow because their throat is too dry to facilitate smooth passage of food. They start avoiding restaurants, avoiding family dinners, avoiding potlucks at work. Not because they don't want to be there, but because they're mortified by how difficult and slow eating has become. They stop enjoying food, full stop. One of life's most basic, most universal pleasures, sitting down to a meal, tasting something wonderful, sharing food with people you love, gone. Not because of a disease they can name at the dinner table, not because of something that shows up on a scan, because of moisture that quietly, invisibly, relentlessly disappeared. And speaking changes too. Your lips stick together mid-word. Your tongue catches on your palate when you're trying to articulate. You lose your train of thought because your mouth is distracting you from your own sentence. If you're someone who speaks for a living, a teacher, a therapist, a saleswoman, this is devastating. It undermines your confidence in the one tool you rely on most, your own voice. There's still another layer most people never hear about. Dry mouth changes your taste perception. Your taste buds require a film of saliva to properly interact with food molecules. That's basic chemosensory physiology. When saliva production drops, food tastes different, blander, flatter, sometimes metallic or bitter. People start adding more salt, more sugar, more sauce to compensate, and their diet suffers without them even realizing why. Others simply lose interest in cooking, in eating well, in nourishing themselves. And when nutrition deteriorates, when the body isn't getting adequate vitamins, minerals, proteins, healthy fats, everything else unravels. Energy, immunity, mood, healing capacity, all of it. I want to share something I've come to understand deeply over many, many years of this work. The body doesn't produce random symptoms. It doesn't waste energy generating meaningless signals. Every persistent discomfort, every change that doesn't resolve on its own, every subtle shift in how you feel from day to day, is language. It's your body communicating with the only vocabulary it has. And dry mouth is a particularly eloquent message. It might be telling you that your medication protocol needs reevaluation. It might be telling you that your breathing architecture at night is compromised and your tissues are suffocating. It might be whispering, persistently, patiently, that your immune system has quietly turned against your own glands. Or it might be sounding an early alarm about metabolic changes, blood sugar dysregulation, hormonal shifts during perimenopause, chronic dehydration patterns, nutritional deficiencies that haven't showed up on any lab work yet but are already reshaping your health from the inside out. The question isn't whether dry mouth matters. It does, profoundly and consequentially. The real question is whether you're going to keep dismissing it for another year, another 5 years, another decade, or whether today is the day you finally listen. So here's what I want you to do. Not tomorrow, not when you get around to it. Now, while this is still fresh in your mind. First, start documenting. Pay attention to when the dryness hits hardest. Is it only in the morning? Throughout the day? Does it worsen after certain meals? After taking specific medications? Does it correlate with your menstrual cycle? With stressful weeks at work? With allergy season? Write it down, track it. This information is pure gold for any clinician who actually takes the time to listen. Second, pull out your medication list. Every single bottle in your cabinet. Look up the side effects for each one. If dry mouth appears, and I promise you, for at least one of those medications it will, bring it to your prescribing physician. There are often alternatives. Not always, but more often than you'd expect. And sometimes, a simple dosage adjustment or timing change can make a meaningful difference. That conversation alone can change the trajectory of your oral and systemic health. Third, get evaluated for mouth breathing at night. A sleep study can reveal it definitively. Even a conversation with an ENT specialist can point you in the right direction. And there are solutions: nasal dilator strips, myofunctional therapy, mouth taping during sleep. Yes, it sounds unusual, but the clinical evidence supporting it is growing rapidly. Positional therapy, CPAP adjustments if you're already using one. Fourth, and I cannot emphasize this enough, if you have dry eyes alongside the dry mouth, if your joints ache persistently, if fatigue follows you like a shadow no matter how much you rest, ask your physician for an autoimmune panel. Specifically request SSA and SSB antibodies, rheumatoid factor, ANA. These are not exotic or expensive tests. Sjogren's can be identified. It can be managed. The joint damage can be slowed. The glandular destruction can be mitigated. But only if someone thinks to look for it. And fifth, protect your mouth right now, today, while you pursue answers. Saliva substitutes and oral moisturizing gels exist, and they work. Xylitol-based lozenges and gums stimulate whatever salivary capacity you still have while inhibiting harmful bacteria. Stay hydrated strategically, not just gulping large amounts of water at once, but sipping consistently throughout the day to maintain mucosal moisture. Run a humidifier in your bedroom at night. And for the love of your teeth, stop using alcohol-based mouthwash. It strips what little moisture you have left and makes every single aspect of the problem worse. These are not complicated steps, but they require one thing. You have to stop accepting dryness as just the way things are now. Because it isn't. It never was. Before I let you go, one more thing. If this video opened your eyes today, if something shifted in the way you think about that dry mouth you've been living with, do me a favor. Share this video with someone who needs to hear it. A friend who always complains about her dentist visits. A sister who hasn't slept well in years. A coworker who carries a water bottle everywhere like a lifeline. You don't always know who around you is silently struggling with something they've never been able to name. And sometimes, I've seen this happen more times than I can count. One shared video is the thing that finally makes someone pick up the phone and schedule the appointment that changes everything. So subscribe to this channel, hit that notification bell, and share this with someone you love. The next video we're working on goes even deeper, and I think you'll want to be here for it. Now, Let me bring you back to where we started. It's 5:47 in the morning. You open your eyes. Your mouth is dry. Your tongue is thick. Your throat burns. But this time, you don't just grab the water and forget about it. This time, you lie there for a moment. You feel it, really feel it, and you recognize it for what it truly is. Not a minor inconvenience, not just dehydration, not just one of those things. It's your body, in its quiet, persistent, deeply intelligent way, asking you to pay attention, asking you to listen, asking you to act. And this time, you do.